We're exploring bioidentical hormone therapy. With us, Dr. Deborah Matthew of Signature Wellness. A question emailed to us, so let's go ahead and take this. This is Alice from Charlotte. What types of hormones are used in replacement? So let's go ahead and get into some of the therapies here. And what are the risks and benefits in relation to cancer? So she has two questions here. Let's first address, Dr. Matthew, the types of hormones used in replacement.
Sure. Well, that's a good question because, you know, often when we look at women's health, we look at estrogen, and estrogen is not the only hormone, and it's not always the most important hormone in a particular woman. So a very common scenario in my office would be a woman who, for example, is in her mid-40s coming in with irritability, anxiety, insomnia, and really exaggerated PMS symptoms, for example, and in this case we would use progesterone, and she may not require estrogen at this point in time, whereas a woman who is, say, 55 years old is no longer having periods and is feeling tired and depressed and having problems with vaginal dryness and fatigue, that woman may need estrogen, progesterone, and testosterone. So it's very individual to the person.
What are the risks and benefits in relation to cancer? Dr. Matthew, you were ready to chime in on something.
Yeah, I just wanted to add a little bit about the concern about breast cancer, because I think that that's the biggest concern that women have when they come to see me. They know that there's a problem with their hormones. They know that they are having hot flashes or whatever their symptoms may be, but they're really frightened. And
it can be scary.
Right. And one of the things that we are learning is that the form of progesterone that we use may make a difference, because the Women's Health Initiative study used a particular form of progesterone called medroxyprogesterone acetate, and that form has been associated with an increase in the risk for breast cancer, whereas the bioidentical form of progesterone is looking in more recent research to not have the same risks. So whether or not the progesterone that's used is bioidentical or not may play a role in breast cancer risk.
And if you should have a concern about therapy, then talk with your individual doctor about that.